Degenerative disc disease is actually a process that can be part of the normal aging process. As early as our late teens, many patients will show signs of histological degradation or cellular disorder in the disc that eventually can lead to pathologic conditions where it causes pain. The outer part of the disc does have small nerve endings in it that basically mediate pain. We call them nociceptive nerve endings. And if the outer part of the disc and the inner part of the disc are not functioning properly, and you load the disc in a manner that is not necessarily physiologic, it can cause pain. That pain may be something that is very brief and may only last a few days to a couple of weeks. In those cases, we generally don't get particularly worried about it from a surgeon's perspective. But it also, in some cases, can linger for much longer and can be refractory to conservative care as well. The conservative treatments are, again, much like the same of all the other treatments of the spine: nonsteroidal anti-inflammatories, physical modalities, and injections. Ultimately, surgery probably plays the smallest role in the diagnosis of degenerative disc disease as it does in some of the other spinal conditions. The reason being is that it is somewhat controversial as to how much surgery helps degenerative disc disease. There are, though, some patients who do very well with surgery in terms of degenerative disc disease, and that's why, again, it is important to have a discussion with your particular surgeon that is both open and frank and talks about the risks, the benefits, and expected and potential outcomes. Those surgical treatments boil down to essentially two types in the case of degenerative disc disease. One is a fusion operation, which is probably the most controversial. The other is disc replacement, where we actually try and replace the disc, much like in a knee or hip replacement, with moving parts that are made out of metal end plates as well as a plastic insert in between that allows motion and tries to preserve motion, but hopefully removes the offending agent that is causing the pain.